people here of 211 is sometimes when we're in those workshops, but we want to keep spreading that awareness. And at the same time, expanding the crisis service to be proactively deployed across the TTC, especially on the streetcars as mentioned, and more of the subway, would help build that connection and awareness with the public when they actually see crisis workers out. What's been done so far is a great start, so let's work to expand the crisis service across transit. We support all the recommendations. Thank you.
Thank you. Any questions to the applicant? No? Thank you so much. Miguel, last speaker.
Good morning, Mayor Chow.
Is your mic on?
4 years of services. This is your last.
Your mic is not on.
Oh, mic is not working. Okay, can you hear me?
Yep.
All right. I just want to say thank you, Mayor Chow, for your last 4 years of continuous service for the City of Toronto. This is the last executive committee of the year before you guys going on break. So I'm trying to connect my iPad. I hope it works this time. Last time it wasn't working. Technology. 1 second, please. Can I get some help? Yeah, sorry. Absolutely. I'm a little bit challenged today.
That's okay.
Thank you. Thank you. All right. So I'm here to say that.
Can you put the mic back on?
I'm a person with mental health issues and physical disabilities. And I want to say that I support the recommendations for this program, the crisis response, because it seems to have a success, and as the report says, it's going to go evolving and increasing as well. So one of the things I want to share with you is this flyer, where perhaps this is something that the community can assist to enhance the crisis response. We can learn how to use this wonderful equipment, the naloxone. We can learn how to use the drug testing kits, et cetera, et cetera. This is something that we should be perhaps considering. Suicides account for almost 75% of men in Canada, in Ontario, in the city of Toronto. It is sad, but it's true. Last week, we have a wonderful event in my community. We were celebrating a barbecue. We have a great time. I invited the mayor. Thank you so much for acknowledging, and I understand you're busy campaigning. But unfortunately, tragic happens. We lost a resident to mental health. That person committed suicide. And we are going to be meeting as a community this Wednesday, tomorrow, to discuss how we can heal together and overcome these difficult challenges of mental health. So I want to thank you for the Toronto Police Services for open up the opportunity for this pilot project. If it wasn't for the police services to support this 211 service, we could have been, doing the same repetition, losing more members of the disability community. But now it's not going to happen because we have a 211 service. And again, I support the recommendations, the financial recommendations to increase staffing. And I want to also recommend, please, Mayor Chow, let's talk transitional housing, and it's an important component that needs to be addressed for members of the community that have lived for a long time in encampments and in the shelter system. If we are going to invite residents to live in Toronto housing, let's make sure that they receive the proper services. And the idea of mixing all residents versus young residents is a bad idea. It has to be strategically done. The Housing Secretariat has recommended the housing strategy to the TCHC. And this program maybe is a success, but it has a problem. There is an issue related to lack of sleep for residents. We're not unable to sleep during the night, and affects us. So we have to be conscious where we put the new residents that are coming out of the encampments with mental health, traumas, addictions, et cetera, et cetera. So 2 recommendations: let's continue training and the use of the naloxone, although we know that they're incorporating horse pills, veterinarian products, and you cannot revive a person with this. You can use it 3 or 4 times, we will not be able to revive them. Only if you have a defibrillator or you have an airbag to resuscitate that person. Unfortunately, everything is being handled by the staff. I will encourage to empower tenants so that if you have received the training, why not give it to someone who may need it instead of waiting for 10 minutes to a community service unit to arrive. Thank you.
Thank you. Any questions? No? Thank you for your time. We ready to, any questions of the staff on this item? Yes, Deputy Mayor Malik.
Thank you very much. I have a couple of questions for staff. Can you share more about how the dispatch system from Toronto Paramedic Services will work alongside 211? What are the outcomes that we're looking for with the multiple pathways?
So through you, Mayor, the dispatch integration with paramedic services will allow the crisis team to be readily dispatched through the 911 system. The benefit of that would be decrease the call transfer time and allow us to identify quickly more calls that would be appropriate for the crisis team that make its way into the 911 call system. Residents and the public will still be able to contact and reach the service through the 211 door, so that will not be a change for residents. The dispatch system is only to help us integrate a quicker response and to work with our colleagues with paramedic services to accomplish this by Q1 of 2027.
Okay. Thank you. The early findings from the TTC pilot are encouraging, and thank you to the speakers who shared also the importance of that and the impact on their kind of experience of the service, especially the 98% diversion rate. I've spoken a lot about the need for the service on our streetcars, and I just want to confirm that TCCS is available on streetcars. And can you also share how we're working to make the TCCS more accessible on other TTC vehicles as well?
So through you, Mayor, the pilot so far within the first 6 months has shown that it's been effective. Some of the learnings that we are taking from the pilot and hope to build on by the end of the year when we receive an evaluation report from MAP, Center for Urban Health Solutions, is for ways for us to increase the pilot to be able to, the service to be able to respond to more calls across the service system. Currently, you are correct, we are able to respond to calls that come in on surface routes, and part of the goal is for us to work with the TTC to increase opportunities for us to respond to those types of calls throughout the years.
And with looking to increase call volumes, can you speak a little bit more to how you're working to address response times? Also, as a frequent caller to 211, it is varied in terms of what the response times are. I was glad to see kind of the reporting of this and that the response times have improved, but just how do we make sure that that is consistent as the service demand increases?
So through you, Mayor, we'll be monitoring the response times as part of our regular quality assurance work. The crisis service is on average alongside other similar crisis services across North America with our response time. In particular, in the TTC pilot, we've seen the response time be as low as 5 minutes, given the physical presence within the U zone. So we will be monitoring this and working with our crisis teams to identify ways to increase response times and also identify if we need additional vans and additional staff on the road to respond to the broader call volume that we anticipate.
Thank you.
Any other question? Oh, Councillor Carol Bravo.
Yes, and I see Chief Jala just came into the area. I want to ask a question that is actually a follow-on from an economic development, a question that I asked Chief Jessup's annual report. Touched on some of the technological pieces that we still need in 911, and one of them is getting to the point where 911 is better able to, in real time, have the various first responders know who's closest, who's getting there, am I really needed? Or can I go on to another call? That sort of thing, which was the promise of Next Gen. But I asked him a question, is that happening now? Can we get to the point where 66% of fire calls are medical? Could there be fewer of those? Or could they be shorter calls? Because they know more quickly that paramedics are already on scene and dealing with the patient. But this report adds another question, because he did say soon, but this report adds another question. If we're sort of more connecting paramedics dispatch to TCCS dispatch, have you had the conversations to make sure that we're dealing with the issue of police have to decide in some cases whether TCCS is going, or does that become a matter of dispatch now and the assessment happens right with the communications officer?
To the chair, that would happen at the time that we get the call. So right. Yeah, those are the decision points that we're still working on to integrate, as Mo touched on, in terms of the integration of the dispatch function within our own communications center. Those are some of the decision points that we're going to be working on to decide, do police also need to attend? Are there aspects of the incident that require police attendance? And those will be incorporated into the final implementation.
But potentially we could get to where it's no longer they must go first, more of a, because we can move faster, it can be they can arrive together and quickly put it in the hands of TCCS.
Sure, there's the potential for that.
Okay, excellent. Yeah. Okay, thank you.
Okay, Councillor Bravo.
Thank you, Mayor. My questions build on my questions to one of the deputants around the importance of the expansion of this program having always a built-in evaluation. Can you give us just a high-level picture of how it's grown from part of the city now to onto transit, and what is it that you do to evaluate post this pilot in the U and the next phase?
So through you, Mayor, we've always integrated evaluation to the development of the crisis service since the initiation in March of 2022. We worked with CAMH at that time to do 2 evaluation reports, one of the 6-month part and then one of the full year part. And those learnings and findings have helped us improve the service along the way. Similar to that best practice, we are also working with the MAP Center for Urban Health Solutions at St. Michael's Hospital to evaluate the pilot and to provide recommendations and findings that we will be integrating as we consider what expanded service looks like across transit.
Speaking to the question of increased impact, you mentioned the evaluation that's being concluded. Is it accurate to say that in the work that you're doing, there are healthcare-facing partners? So there's a piece here around interacting from the municipal level and the interventions that we make here, including through all first responders, Toronto Community Crisis Service. But there is a kind of a need for a healthcare system, provincial role here for a handoff when people are needing what they actually need is healthcare service. Can you talk a bit about how what you're doing and learning, or how much healthcare practitioners are part of the evaluative process to make recommendations about how we can best do this work?
So through you, Mayor, certainly healthcare partners are key to this work. Our existing community anchor partners have as part of their ecosystem. Community health centers have part of their ecosystem of referral partners, specific supports around counseling and mental health supports. So healthcare partners are very much integrated into our overall service design and service delivery. And in the intentional selection of St. Michael's Hospital and their partnership in this evaluation, we're trying to ensure that we're able to lift up any gaps and opportunities for advocacy in terms of intergovernmental ask as part of this evaluation.
Thank you. I think certainly all of the systems that are, in addition to healthcare, the child welfare system, workforce questions, corrections, all of these things are provincial jurisdiction. But thank you, that's really helpful to hear that there are partners with expertise that are going to be looking as we move forward about what we can be talking to the provincial government about in terms of supplement. Once we have a person in crisis, there has to be a handover when they need extra help. So thank you for that.
Deputy Mayor Morley.
Thanks, Madam Mayor. Through you, just a few quick questions. In terms of the work to promote the services available, we heard from the deputants the importance of that and making sure that folks who are on the system are aware of the services that they can connect in with. Can you talk to us a little bit about what work is being done to promote this service and how folks can access it?
So through you, Mayor, we've worked with our colleagues at the TTC to have a regular announcement on the PA system in the U zone to indicate that there are supports available at various different stations. We've also worked with our colleagues at TTC to promote the Safe Transit app to let riders know they can use that app to access supports. And we've also, as part of our ongoing Make the Right Call campaign with our colleagues in communications, have an ongoing campaign where we're promoting the crisis service both in subway stations, but also above ground at various different transit bus shelters.
Great, that's helpful, and we'll look at some of that work as part of hopefully a next budget process. In terms of the, one of the things that had come up was just the time sometimes that it takes for a response. And this is just a high level question. I don't know if yourself or maybe someone in TTC can respond. But I'm aware we have like the emergency strips. So if you are in crisis, those are typically available within the subway. What is the function of those? And could those also serve to potentially deploy TCCS workers to the places where they're needed?
Sure, I'll take that question. So through you, Madam Mayor. So when someone hits a passenger assistance alarm, an alarm goes to transit control. The train, if it's in the tunnel, will not stop in the tunnel. It will stop at the next station. In the meantime, the operator has already contacted control to let them know what car the alarm is on at, and then there will be appropriate response personnel that will be attending at the station. We have a variety of different response personnel. We have customer service agents in each and every single one of the stations during peak periods. We also have station supervisors. And based on what the operator and the response personnel see, we will triage to our transit control center to get the right level of or the appropriate response personnel to deal with the situation.
Great. So the example that was shared with us from one of the deputants was a person in crisis, erratic, shouting potentially self-harm issues and, creating a feeling of unsafety, but not directly being unsafe, immediately to others. Would that qualify as an instance where it would be appropriate for a TTC rider to press the passenger assistance alarm button?
Yes, it would.
Great. Cool. That's all of my questions, Madam Mayor. Thank you so much.
To speak. Seeing no other question. Councillor Carroll, any other speaker?
Yes, I just wanted to speak to the evolution of this, and I also chose to speak because while we're just receiving and this update will be ongoing and the expansion ongoing, it needs to be said that the police are very much in favor of this. Because I think if we remember, if we go back to 2020, we weren't so sure. when we were moving this motion in June, we weren't 100% sure how they were going to come on board. But we are now in a place where it's still out for consultation, but we are working on yet another reconfiguration to uniform mental health crisis response because we can. Because the service knows the success of TCCS and has faith in it, they're now looking at that shift of there are things we could be doing. We're doing quite as much here. We're seeing that Next Gen 911 is going to deliver the technological pieces we need. They've even implemented on the non-emergency line, they're working on training large language models, not just to take non-emergency calls and send them off, but there are people hoping to avoid, a full-on uniform response. Maybe they don't know about 211. They call the non-emergency phone line, and in fact, someone needs to pick up that line quickly because sometimes it is an emergency, and they're reluctant to sound that much alarm, but you can tell that the crisis is there. And so they're very much in favor of the expansion and very much sort of willing to shift away from this because they've firsthand witnessed the success that the TCCS workers have on site. And so the handoff, they're more and more willing to do the handoff. And the kind of bragging about the success of the program in this report is showing up in their reports in another room. So I think we're definitely on the right track. It's been a journey from 2020, as Mo knows, but it's certainly going well. Thank you, Madam Speaker, Madam Mayor.
Thank you. I have a motion in front of you. Basically, is to expand the crisis workers service to all TTCs. Why not? They are needed. If you look at the result of the pilot project, you're looking at 2,840 people in crisis, just in that U shape. And then they were dealt with by these crisis workers. Think about the impact of these lives, almost 3,000 lives, being able to have referral, a listening ear, some form of care, referral to appropriate services. And then there's another group, 783 of them, that have thought about harming themselves. And you heard from Miguel about the tragedy that when you lose a person in a community of suicide. And we all know that during that period, the 10, 14 days, if a person is considered harming themselves, if you have a crisis intervention during that period, their lives can turn around. I happen to know a lot about this area because I worked for 2 years as a crisis intervention worker at the Toronto East General Hospital, now called Miguel Hospital, in the emergency service. So looking at these figures, thinking about the 783 people whose life had been altered in a fairly dramatic way by these crisis workers, tells me this is a service that are really, really much needed, not just in the lower part of the TDC, it needs it across the entire subway TDC service. Now, these workers already are deployed across the city, but when we first set it up, they're not allowed to get into the subway station, or at least they are not asked to go into the subway station. So we piloted it. So the original piece is a step at a time. The City of Toronto, working with the police, working with the community agencies, working with experts, said, let us start this crisis intervention team. And it started smaller, didn't cover the entire city. We came on and said, let's just have it cover the entire city, and we evaluated. We had partners, we have mental health experts, we It's always through evaluation, facts-based, look at the figures, look at the impact. Yes, then it's across the city, and we thought, okay, why not the TDC? Then we piloted it. Is now I'm pushing it to say, let us just do the entire TDC. A step at a time, a plan together with all our partners, and you're seeing the success of it, lives being influenced, and in some case saved. But what is one element is this: we are a local government using property taxes. Mental health, the word health, is a provincial federal responsibility. And we need to talk to our other levels of government, other orders of government, to say, please look at this data. Look at what we have done, step by step, following through with the police, with mental health experts, with the community. Look at the impact it had. And they need to be involved. And they need to see the kind of success we have, and I'm sure other municipalities can use it too. So I'm very proud of this service, and I hope that you support this, this extension to across the city. Thank you. And I have Councillor Brafo and Councillor Perks.
I think that we can claim that pride, and when it comes to the creation of Toronto Community Crisis Service, in partnership across so many elements of the city. It's interdivisional with the support of all police and paramedics. This has grown with evidence and data built in. So we can take that to the provincial and federal government and say we have the data and the responsibility for healthcare and for other systems that are broken belong to them, particularly the provincial government. There's something here that I think is really important to lift up. As a TTC commissioner and a daily transit rider and a daily subway rider, I can say I agree with the deputants that the ride has gotten better. There are fewer incidents. There are fewer less sense of insecurity. People are getting help. It was also super fast today, I have to say. And I think that we should recognize that this is leading work, not just in Canada, but globally. This is leading work, and we should lift up the fact that this local government can do so much innovative work because it's building on people's real experiences, and we do it here openly. We do it. You can look at you can look into how funds are being spent down to the dollar for this program, studied all the way through. In terms of to understanding what other elements of the city, I think it's important to remember that there are shelter beds that are held back because if a person is in crisis, sometimes what they need is actually to come inside. So that's Toronto Shelter Services and supports. The other things that are really crucial around the long life that this intervention has includes the fact that there's a high rate of people accepting help to create other kinds of plans to make their life better. So that's an incredible success. The innovative work of involving healthcare practitioners, people with relationships with hospitals and expertise means that we're opening a line of communication with the provincial healthcare ministry and the federal government so that we can demonstrate that property taxes have funded this innovation, but what we need is a massive amount of provincial help so that when we find a person who's in crisis, when they accept help, when they're ready, there has to be a handoff. There's a lot of effort being made in the interdivisional work with social development, the Toronto Shelter Division, to really have a more care and case management approach to people. Where's the care and case management on the other side? This is finally, I want to say, there are people that say that things don't happen at the local level and that they want to be proud of Toronto. This should make every single person proud and every member of council proud. And I want to thank the mayor for coming in with a very clear agenda and understanding that for quality of life, this is a really important piece of work, and for transit riders, It's going to make life so much better. Thank you.
Thank you. Councillor Perks?
Thank you. Lately, for reasons, I've been reflecting a lot on what government is for. And I think today we're at a moment where we can answer some of those questions of what government is for. Questions like, what is efficiency? And what is safety? And whose safety matters? Thinking about efficiency, you know, the conversation in public and here and in the media for years and years and years seems to be efficiency is a department coming in with a smaller budget this year than last year. And that's it. That's the end of it. And that, of course, is nonsense. Efficiency is using the right tool for the right job. And here what we've done is looked and realized we didn't have the right tools. And instead of just saying to all the other departments, you know, cut your budget, we actually made an investment. We're spending money developing a new service and, frankly, training people to deliver a service that has never been delivered before and building out a whole cadre of people who have the skills, training, and so on to help people in crisis. So, and the outcome is we spend less money in the long run because we're sending the right people at the right time to do the right job instead of sending the wrong people who are very expensive and getting the wrong outcome. It's a case for why government matters and why we are the instrument by which everybody invests together to make everyone's lives better. That's efficiency. Well, thinking about what safety is, there's a conversation about safety. Safety is a couple of things. Safety is actually reducing the amount of harm done in a community. And this service very much does that. But it's also whether people feel safe. And I think there's a really interesting thing about this service and helping people feel safe. We actually have a service, and more people have heard of it. I know, knocking on doors and talking to constituents, people now know that we have something called community crisis response. And the fascinating thing about that is if you're just an ordinary person and you're, like me, a daily transit rider, you see somebody acting in ways that are unusual to you and maybe a bit frightening, because you don't know what to do. You don't know why that person is behaving that way. You just know they're behaving differently from how you behave and how you expect everyone else to behave. But because we've created this language, this service, this thing that people see called crisis, now people riding the subway understand that person is not a threat to my safety. That person is a person in crisis. So by creating a public service named that, we're giving everybody the tools to see in an empathetic way what is going on in their city around them. And that's a remarkable accomplishment, and it also contributes to people's feeling of safety. Now I understand what's happening with that person, and I understand that, you know, as a citizen or a resident of Toronto, through my government, I'm contributing to this not becoming a harmful outcome. And that makes people feel safer. And finally, I think there's an important question around safety for whom. Too many times I've gone to town hall meetings and so on talking about safety in the community. And it very explicitly becomes safety of people with relative privileges. I don't feel safe because of those others. And because we're now talking about creating a service where I'm safer because that person with fewer privileges than I am is getting services, is a radical transformation in how we think of safety for whom. And just a little, you know, it's not a direct comparison. Think about this service and then think about ICE. And you get a sense of why Toronto is a leader and why what we're doing here is so important.
Well said. ICE, yes. Any other speaker? No? Deputy Mayor Moreland?
Thank you, Madam Mayor. I just am so jarred by that comparison, and I just wanted to say I want to congratulate and thank all the members of our leadership team who have been part of this work since 2020, including the councillors who helped to get it off the ground. I know I was very proud to stand with Councillor Bravo as part of the expansion when we did move forward with that, and now we're in TTC, and we are hearing and seeing about the positive impacts. I share the sentiments we heard from many of the deputants today about the heavy heart that we have to carry through the city when we see neighbors struggling on our streets and those in deep crisis. And in this type of program, this type of service targeted at those who need it most is building and supports the culture of care that we have here in the city that we're all so proud of. And I'm incredibly proud to be a member of this council, having been part of this great work. So I would be remiss not to say that, Madam Mayor, thank you for the opportunity.
Okay, thank you. Deputy Mayor Malik.
Thank you very much, and want to echo the thanks to staff for this report back. And every time